Knockoff weight loss drugs not only costing consumers money, but posing a real health threat. The illegal imports now the target of federal warnings. Here's the I-Team's Cynthia Gould.
The FBI warns that counterfeit versions of compounded drugs have been found to contain unknown drugs, high levels of impurities, and unsafe or unapproved drugs. And that could lead to cardiac issues, gastrointestinal and nervous system disorders, even death. The warning cites medical spas, pharmacies, and weight loss centers who claim their compounded drugs contain semaglutide, the active ingredient in Ozempic and Wegovy.
There is an enormous quantity of illegal ingredients being shipped into the country from manufacturers that are not registered with the FDA. Some of it marked for compounding, which is hugely dangerous to Americans.
The Partnership for Safe Medicines released a new report detailing unauthorized, illegal, and suspicious ingredients found in injectables coming from countries like China.
We've seen even methamphetamine put into a fake version of Ozempic, which I bet would cause you to lose weight, but is also unhealthy in many, many, many ways.
Executive Director Shabir Ember Safdar says you should question whether the compounded drug was made in a sterile environment in a licensed facility.
Maybe it also has like botulism or a bacteria that is going to infect your body. And once you inject that, that's very, very dangerous. So sterility is as important as the right ingredients. When you inject yourself with a medicine that you don't know was made in a sterile facility and you don't know what's in it, there's no limit to how dangerous that consequence could be. Like, to say that you would die is probably not even an exaggeration.
His advice? Work with a regular doctor who can fine-tune dosing on the drugs, not telehealth. Use compounded medicines as a last resort. Stick with products from the manufacturer. Avoid online purchases.
You are really taking your life in your hands, and that's why that relationship with your doctor is so critical.
Cardiologist Dr. David Fino says with prescription drugs, you know what you're getting.
Some of these outside agencies that are outside of what we do in modern medicine, you have no idea what you're putting into your body. Things like sudden cardiac death have been reported.
He explains with medication shortages improving and prices dropping, patients have more options. Cash pay programs, Medicare and Medicaid now offering coverage.
Today we have 2 generic options that some patients may be able to afford. It brings that cost down.
But many insurance plans exclude weight loss drugs and diabetes coverage varies.
I went from 226 pounds in June of 2022, and I'm now down to 121.
That's despite dramatic stories of weight loss and improved health.
We're finding fewer heart attacks, fewer strokes, less likelihood of dying.
Cynthia Gould, ABC 3340 News.
The I-Team watching your tax dollars. If you see government waste in your community, send us an email, iTeam@abc3340.com. And we want to know what you think. What is your biggest concern about weight loss drugs? You can vote on our online poll on abc3340.com. Scan the QR code on your screen to go there now.